no one is required to take the vaccine. However, it's an advantage to both you and the people in the public, because what we want to do is, one, get people individually protected, but what we're also trying to do is create what we call herd immunity, meaning that the population is immune and therefore the virus will dissolve out of you from people and won't be infectious. And so if you draw the correlation with what we were able to do years ago with polio, we basically eradicated polio from the globe based on a very aggressive vaccination program throughout the world. And that made the disease actually go away. So the vaccines that we currently have, there are 2 of them, and they're given in 2 shots, what we call the primer dose and a booster dose. The primer dose is the first shot. The booster dose is a second shot. And they both go into the muscle in your arm. And depending on which vaccine you get, you need to get your booster dose at 3 weeks, or depending on which shot, 3 weeks or 4 weeks. The brand of the vaccines are not interchangeable, meaning if you get the Pfizer vaccine, you need to have the Pfizer booster dose. If you get the Moderna vaccine, you need to have the Moderna booster dose. If you've had COVID, you do need to get vaccinated. And the reason being that when you have the disease, we don't know what level of immunity your body holds on to. But with a vaccine, we know that you develop a good immunity to the virus going forward. Some people develop immunity at different levels. And the reason for the vaccine is we have a defined amount of immunity that your body will hold on to. So the side effects are minimal. And they're the typical side effects you encounter with a flu vaccine. So that might be soreness at the injection site. That's the number 1 side effect. And then occasionally people feel fatigued, and some actually may have a low-grade fever. The side effects usually only last for a day or 2, but they're rather mild and they're consistent with what you would get if you got an influenza vaccine. Because of the way the vaccine is developed, using a certain type of portion of the virus, that the portion of the virus that we use to develop the vaccine is not the part that is mutating. So therefore, we think in this early stage of seeing mutations that the vaccine should hold up against all these different strains that are developing. No, and there's a couple reasons for that. One is the social distancing, mask wearing protects both you and others, so it's a dual mechanism. The other thing is that there are asymptomatic carriers of the virus. So even though you've been vaccinated, you may be a carrier, and in this early stage, until there's mass population vaccinated, we want to protect others from these asymptomatic carriers. And then third, the vaccine is only 95% effective, which is exceptional when it comes to vaccines, but there are still 5% of people who don't mount an immune response with the vaccine. So even though that's very low, there's still a possibility that you could be one of those people that doesn't mount an immune response due to the vaccine. Not at all. It's a phased-in approach. There's going to be plenty of vaccine. And right now we're encouraging all those with high risk to get it when they can get it, not worry about what's going to happen in the future, because the development of additional supply is robust right now, and it should not be a problem in the future. So the primary thing we want to do is those who know they need it should take care of themselves and jump at the opportunity to get it. I have been, I work in the emergency department as well, and I have been taking care of patients with COVID from the day one. Interestingly enough, my colleagues and I have been tested for antibodies to COVID, and most of us don't have any antibodies. So it's a testament that the personal protective equipment does work when worn appropriately and judiciously. And so I was tested as recently as 2 weeks ago prior to getting my vaccine, and I still had no antibodies, which is kind of amazing to me just because of the level of exposure that I've had. And my ER colleagues, I can tell you, physician colleagues and nurses, they also have the same only a few of them have antibodies. So the personal protective equipment is safe, it works, and it's really what keeps you safe. I did get the first vaccine, my first dose of the vaccine, and I'm scheduled to get my second dose next week. And I had no adverse effects or side effects from it. The vaccine is a great thing. Don't be afraid of it. I realize that some of our population has lived through vaccine trials in the past, and they may be a little timid, but modern vaccine development is so much different than what it used to be. And it's very safe, it's very effective. The fact that we have a vaccine that's 95% effective is very unusual in vaccine development. And then just do common sense things to protect yourself. Like I said, the personal protective equipment works, social distancing has worked in the settings where it's practiced, routinely. So we'll get through this, and I think there's good things to come.